This short video has been developed to introduce our research project, Core Outcome Measures in Brachial Plexus Injuries, CoMBInE for short. The aim of the study is to find out the most important issues affecting adults following a traumatic brachial plexus injury. Researchers develop and test treatments to make sure they work and are safe. To do this, they look at the effects new treatments have on patients by measuring outcomes. What is an outcome? An outcome is something we can measure that tells us how a treatment affects a patient's recovery, health and well-being. For example, how much pain a patient may feel, the movement or feeling in the arm, or if they feel worried or depressed about their injury. But there is a problem, because the same outcomes are not always measured for a brachial plexus injury, and different researchers throughout the world often measure different outcomes. When the brachial plexus studies are finished, the results of the treatments can't be compared or combined because they've used different outcomes. It is then difficult to know which treatment is best. To be able to compare evidence about these treatments, we need to agree on the most important outcomes after a traumatic brachial plexus injury. This decision needs to involve patients, doctors, nurses and therapists. To do this, a list of all potentially important outcomes will be created. And if you are involved in the study, you will be asked to say how important you think each outcome is by completing an online questionnaire. This will take about 20 minutes. You will be asked to rate the outcomes from not important, rated as number 1, to critically important, rated as number 9. Questions relate to the person answering. A second and third questionnaire is then sent to those who filled the first one. This tells the reader other people's ratings of importance for each outcome. The aim is to achieve overall agreement and provides the opportunity for people to change their mind. Lastly, there is a meeting where everyone will discuss the findings and agree the final small set of outcomes, which all clinicians and researchers must use. In this way, we will have research which we can compare and then have a strong basis from which to make decisions about what works. If you would like to know more about the study and are interested in being involved, then please contact us at Twitter @StudyCoMBInE and email combinebrachialplexus@gmail.com.